Right, we are back recording and ready to hand it over to you.
Thank you, Cashin, and thank you everyone for being on the call today. My name is Denise Harlow, and I'm the CEO of the National Community Action Partnership and have met many of you over the last few years as we have developed the CSPG organizational standards, and we know that we worked with public CAAs during the development process to strategize and figure out how do we establish organizational standards. So I'm getting a lot of feedback. Thank you. On how we develop these organizational standards for public entities. We know that you have some unique issues that you need to talk about. We hope that today's call is not the only call. We would like to have several of these as you also, just like the nonprofit CAAs, ramp up to implement organizational standards by the beginning of federal fiscal year 2016, which is October 1st. Now we know in some states across the country, contract years start at odd times, so there might be some unique differences in your individual states, but for the most part, most states are starting October 1st of this year. Just some technical things. I ended up having to be out of the office today, so my apologies that we're not all in the same spot as the partnership team, so I will pause periodically and ask Cashin to share with me any comments or questions that come in through the chat window, or if people do raise your hands and you want to be unmuted to talk about your question, which is certainly preferable, we'll certainly take moments to do that. So unfortunately, it won't work as seamlessly as we usually try to make it happen, but we'll try to make sure we get to your questions. So, Cashin, before we get started, are there other things that have come in already through the chat window or other questions that have come in via email that I need to know about, so as we go through today's talk, we can make sure to highlight?
We haven't seen anything coming in today. We had just a couple of questions that came in last week, so we have those incorporated.
Okay, great. All right, so and Cashin will be reading my mind and flipping through the slides, but we're going to go to the agenda window here, and please put your questions into the chat window or click the raise your hand feature, because we definitely would like this to be a conversation, although we know that's not always possible given technology, but let's see what we can do today. So what we want to do is talk a little bit about the organizational standards and make sure everyone's kind of on the same page with the purpose and intent of the organizational standards, talk about implementation, talk for some tools around implementation specific to public CAAs, and then kind of walk through assessment issues when it comes to public CAAs and the CSPG organizational standards. So if we start off by going to the next slide, I just always like to start off our discussions with making sure that we're understanding that this is a comprehensive performance management change in our network. It's not just about organizational standards, that certainly the Roma Next Generation is coming. We know that there will be new family indicators. We believe that there will be some new community indicators. We don't know exactly what's happening with the agency indicators at this point, but we do know that the organizational standards certainly will tell OCS much more about organizational capacity and performance than perhaps things have in the past. All of these things will be working then alongside the state and federal accountability measures, and hope many of you saw the Dear Colleague letter. If you haven't, the Dear Colleague letter hit late last week on the new updated model state plan for states. And I know that staff agencies were oftentimes focused on the standards. A lot of feedback. You make sure to mute it on your end. I think that would be helpful. Thank you. All right. Sorry about that, folks. So there was a Dear Colleague letter that came out last week that released the next version of the model state plan. And as CAAs, oftentimes we leave that up to the states to look at, but I think it's going to be critically important for all CAAs, public and private, to make sure we're familiar with what's in that model state plan. It talks a lot about how often and when we get monitored, what that process might, in terms of organizational standards, needing to talk about how many agencies are meeting 100% of the organizational standards and elements like that. So I encourage you to take a look at that Dear Colleague letter. But certainly IM 138 is what we want to talk about here today. You may recall at the end of January, IM 138 hit the streets, and the first half of it really is talking about implementation, and the second half lays out the final CSPG organizational standards by both private entities and public entities. On the next slide, we talk about what's in that front part of that IM, is that this summer, the state plans will be going into OCS that talk about how states will be implementing CSPG organizational standards. And I do believe in some places across the country we're already beginning to see state offices incorporate standards into their monitoring instruments. I have heard of at least one state who is actually monitoring against the standards this month, that they've been incorporated in their new tool. So they're already kind of out of the gate. Others have kind of really been waiting for the IM to hit and to figure out what this process is going to look like before they modify their monitoring tools. But we know this summer states will need to address standards in their state plan, and by, again, October 1st, all states will implement standards. Now, this will certainly have an impact on the state plan, but will also have an impact on monitoring and finally the annual report. In terms of monitoring, I know many states have had the option to monitor at least once every 3 years. Some states do it every year, some states come out every 2 years, and some states do the every 3 years model. However, under organizational standards, they're going to have to find a way to assess all agencies against all the standards every year. Now, we know that staff capacity at local agencies, both public and private, can be stretched very, very thin. We know that some public caps get very small amounts of CSBG money, especially like in Colorado. So we have to figure out what all of that means for states and then for the public entities. And then the annual report, historically we've always looked at that kind of as the IS report. However, that's really going to be much more of a broad scope tool going forward. They'll be assessing certainly against the standards. They'll be needing to report there, but they're also going to need to report against all of the state measures as well as your IS data and the NPIs. So that annual report will become a bit of a bigger document. We have not yet seen a draft of that, but we know it's coming. All right, the next slide, again, I'd just like to show this because this is OCS's slide that really lays standards next to the federal and state accountability measures, next to Roma Next Generation. Again, talking about all of these pieces driving program improvement.
And Roma is the CSBG speak for results-oriented management and accountability or something like that? Yeah.
Yes, and I back there. Yeah, Roma, results-oriented management and accountability. We'll talk about this in a bit because one of the standards I know has been confusing for agencies in terms of how we document our full continuous use of the Roma cycle. So we'll certainly talk about that. The next slide is again, another OCS slide that talks about the difference of the standards vis-a-vis the national performance indicators. So the standards and the state and federal accountability measures are on, again, the one side of the slide that talks about how well did the network perform. And the other side, really the reason we're all in this business to begin with, is about what difference did our agencies actually make in the lives of families. And that's really where Roma Next Generation is coming into play and the new national performance indicators. So if we go to the next slide again, this is just the cover of our organizational standards document. It is up on our website, communityactionpartnership.com. If you go to update on organizational standards, we'll show you this later in the discussion. It'll take you, and you can download a copy of this text. If you can't find it, email us, and we're happy to send it to you. Again, I'm just putting out some slides here to make sure we're all on the same page. So the next slide, again, talks about the 9 categorical areas into the 3 thematic groups we have to categorize the organizational standards. Both public and private entities have standards in each of these 9 categories. We have maximum feasible participation, vision and direction, and operations and accountability. And again, when we walk through the standards, if you look at them side by side, the public with the private, there are 58 standards for the private entities. And I say only 50 for the public because I know it's not really only 50, is still a significant amount. The private caps, we do try to explain that public caps operate differently than a nonprofit would. Your finance department, your HR departments, many of you, not all, but many of you have different structures where those departments are encompassed in other parts of local municipal government, whether it's city government, county government, whatever that structure looks like. Some standards just don't apply the way public entities are structured. And finally, we'll show you here the Roma cycle. We always like to include this in our conversation. Again, Roma really is not just the NPIs, and a lot of times we think about Roma as just those NPIs that we have to report to the state. But really, both public and private caps do need to follow the Roma cycle, which basically just means everything that you're already doing, right? You're assessing community needs, you're doing CAP, you're doing agency planning and some level of strategic planning, you're implementing programs and services based on the needs in your community. We can talk to what degree that may or may not be the case. I know certainly in public CAPs, sometimes that's not always, doesn't quite have the flexibility that the private CAPs do. You document your achievement of results and your data entry and your IS data and all that good stuff. And then hopefully you're analyzing and evaluating your performance as you go through the cycle again. So each element of this cycle is applicable both to private entities as well as the public CAPs. And we'll talk about how the standards fit along each of these components of the Roma cycle. So I'm going to pause here, and I know I can talk very quickly, so my apologies for that. Cashin, have there been any questions or any raised hands so far?
We do have a raised hand. Maria Rodriguez, if you have a question, you are unmuted on our side to try to ask it. And keep in mind that you may have muted your device on your side. Okay, well, we can always come back to it, or you can put your questions in the chat window. That is the only one that I see up at the moment.
Well, we appreciate the attempt, Maria, and hopefully we can figure out the muting issue, because certainly conversation is probably better for everybody, so appreciate the attempt. All right, so let's go to the next slide then. IM 138, again, talks about states are responsible for ensuring that all eligible entities, public and private, meet all state-established organizational standards. Now, we do like to make clear that this state-established because currently CSBG is and is remaining a block grant, and right now there are no national OCS standards. They're technically the Center of Excellence developed standards. There's a variety of reasons behind them that we could get into probably, but at least at this point, I think what we need to know is that this is the way the IM is written the way it is that it's state-established organizational standards. I think the key thing here, though, that several standards might take a couple of years for all eligible entities to meet, but they're hoping that every agency, public and private, will make steady progress toward meeting all of the standards. So during the assessment, if a state finds that an eligible entity or a CAP agency is not meeting a standard or a set of standards, the state's response will depend certainly on a couple of different circumstances. And the first piece is that states will have the option to develop a technical assistance plan. As you may recall, currently in IM 116 and in the CSBG Act, there's really only one option for states if we as local agencies are not performing, and that's a quality improvement plan that implements a set of corrective action items. What we like about IM 138 is it gives states and entities the option to go down a technical assistance road first. Take some time to get things improved, maybe you need some training, maybe you don't have a strategic plan in place, maybe you need some assistance with your advisory board. What can we do as a network to help you and your entity get up to speed and be in compliance with the standards? So certainly there will be some time hopefully given to that process. But you can see here, if appropriate in other situations, the state may still initiate action, including a QIP, a quality improvement plan, and a corrective action plan, because again, IM 116 isn't going anywhere, it's just we're getting another option in terms of a TAP. But as long as the state is confident that you as a local entity is moving forward toward meeting the organizational standards under a technical assistance plan or a QIP, the state should not initiate to terminate or reduce funding. However, we do have to put this hedge in the next slide, that the failure to meet multiple standards might reflect additional deeper challenges, or if the state determines, for instance, if there are some serious issues such as fraud, embezzlement, you're close to going out of business, you don't have the resources to pay your bills, they still could potentially go down the IM 116 route with corrective action. Again, still time to improve, though, unless it's serious, and then down a process with public hearing, but nothing in that, all that system has been in place already. But again, nothing takes away IM 116, it just gives it the option to do technical assistance first. So again, I know we're focused on agencies, but I think it's good to remember what states need to do. They need to make sure they're following a process that's consistent with state rules, which might take some states longer than others. And as public entities, I'm sure you can well appreciate the challenges the states have to go through to implement the standards. You may be experiencing some of these same challenges at the local level with municipal requirements, approval processes, rules and regulations that you need to follow as a governmental entity. The states are supposed to be allowing for input from boards and leadership of all eligible entities, public and private. They hopefully will be getting to integrate, if they haven't already, these standards into their state plans, their contracts with you, funding documents, monitoring instruments, etc. Hopefully they will be clearly communicating their expectations around standards, around oversight and monitoring. We know that agencies and states are both stretched with capacity, so I know that in many places this is happening, but it may be slower than everyone kind of hoped because there are some challenges with capacity. So if you go to the next slide, again, if a state decides they're going to make changes to the COE, Center of Excellence Developed Standards, they can do that. A state can modify the standards if they so choose, but they need to document their rationale for the changes in their state plan and their reporting to the feds. And again, any modification, if they choose a different set of standards or they modify the COE standards, OCS will need to review and approve. So we believe most states are using the COE developed standards. So moving into the state plan then, again this summer, we know there are 12 or 13 states who did a state plan last year, and so they're halfway through their 2-year state plan process. It looks like they're going to do some level of amendment to that mid-term state plan for states that already did this last year but need to update it regarding the standards. But for most states, this is the year they're submitting a state plan. That's usually a 2-year state plan. They're going to need to talk about, are they using the Center of Excellence developed standards, or are they going to use an alternate set? They're going to need to talk about their approach for monitoring and assessing you against those standards, talk about the procedure for corrective action. And then there are levels of exceptions for organizational standards. And I think that's important to note, especially for public entities, because I know I like to call it the Colorado exception. Colorado has a large number of public caps who get very small amounts of money. So there are exceptions allowed for eligible entities that receive less than $15,000 in CSBG or have a budget less than $50,000. Now, or I should also say it also allows exceptions for state-funded tribal entities. Now, none of that lets those agencies off the hook for standards. The states are going to have to come up with an alternative set. If they don't want to use the COE standards, they still have to come up with some level of standards for those agencies, but they do not have to use the 50 established standards from the Center of Excellence. So let's walk through what's changed in the specific organizational standards, and then again, we're going to pause for questions again. There are 2 new standards that were added. You may recall previously we had 48 standards for public entities. Now we have 50. And there were several significant modifications, certainly one of which we want to highlight today. So let's first talk about the 2 that were added. So there is now a new standard 3.4. That doesn't mean the old 3.4 went away. It just bounced down to 3.5. So the new 3.4 is the community assessment, includes key findings on the causes and conditions of poverty and the needs of the communities assessed. Now, as public entities, as CAP agencies, you've historically had to do a community assessment, so that's not changing. You may recall some of the other standards talk about an assessment being done every 3 years. There are things around qualitative and quantitative data, things like that, but those have been in the draft standards for a year and a half. This is new, though, that your community assessment now probably should have. If I was a CAP director, I would include a key findings section in my community assessment. And in that key findings section, I would have the critical issues that have come up in my community and list the top needs of the community that we assessed. And then I would talk about the causes and conditions of poverty from a broad brush perspective. Those are the macro issues, things like lack of living wage jobs, lack of affordable housing, lack of comprehensive public transportation systems, things that really impact broad swaths of our community and our macro changes, community-level changes, in essence. But again, most community assessments that I've seen from community action agencies fit that bill. but it may require you to do something a little bit different. And I also know that some public entities utilize other existing assessment processes that are going on in your community, which is okay to do. But if there are no key finding sections, you may want to, as a public entity, through your advisory board or something, tease out what you see to be the critical findings out of that report, and perhaps have an addendum or a separate document that you could then show to the state. See, our advisory board did look at the needs assessment. We pulled out what the critical issues specific to poverty are, and then we also address what those broad brush issues are. Now, some agencies are hesitant to do the macro issues because there's not enough money in your budgets to impact those macro changes. But in community action, we do like to say we have to assess the needs, but oftentimes we're partnering in other ways to help meet those gaps, if possible. We don't always get to make those programs happen within our own entity. All right, let's go on to the next new standard, 4.4. Again, the old 4.4 didn't go away, just bounced down. So we're getting some feedback there, Cashin. I don't know if you're able to mute them. The new standard 4.4, the tripartite board or advisory body receives an annual update on the success of the specific strategies included in the community action plan. Again, very similar to what's on the private side. You may recall that in the strategic planning standards, your advisory body, your tripartite board, needs to get an update on your strategic plan progress. Here it is your CAP plan. Now, some people say, Denise, isn't your CAP plan and your strategic plan the same thing? And I do like to clarify that it's not. Your CAP plan is really your contract that you have with the state in terms of how you're designing your program, what you're going to be doing in your program, and the outcomes you're looking to achieve. So many of you probably already do update your tripartite advisory body around what's happening in your CAP plan. It might even be easier for a public entity, if you're a CSBG department or something like that, that's more narrow in scope. It may be more logical that way, but perhaps not. I know a lot of public CAPs have a lot of different programs running through them as well. So this is specifically addressing your CAP plan. And finally, I want to walk through, again, the significant modification to 9.3. The previous language that was in the draft standards that the organization or the department has analyzed its outcomes within the past 12 months. A few more words were added, but the new 9.3 reads, the department has presented to the tripartite board or advisory body for review or action, which means the body can just review it. They do not have to take action. They could. They need to do that review at least once within the past 12 months, and it needs to include an analysis of your department's outcomes and any sort of operational or program adjustments or improvement identified as necessary. The idea here is that Section 9 does align, again, with that final component of the wellness cycle where we talk about analysis and evaluation. This standard really tries to talk about the advisory body of a public CAP needs to look on an annual basis what's going on in the agency, what kind of outcomes have we achieved, and do we need to make any modifications. I do acknowledge that a lot of times in public CAPs, and even on the private side, there's not going to be adjustments that you can make. Maybe using programs of these resources in a particular way that have been determined by the powers that be, but that may be higher up the food chain, as it were. So the advisory body may not have any flexibility. The idea here is that it's supposed to reflect that concept of a tripartite board and advisory body, looking at what's going on, assessing, and trying to make changes where possible. So again, I've been talking a lot, so I'm going to pause. Cash in any raised hands or any questions through the chat window.
We do have a hand up. George Davis, you are unmuted on our side. Feel free to ask your question or make your comment. And same note as before, you may have muted the device on your side. All right. That is all that I see, unless Maria Rodriguez figured out her mute and unmute, in which case now would be a great time to jump in. All right.
You gotta love technology.
in that case, then we'll, like I said, any questions that come through the chat window will be read out as well. So if you're a little shy, then that will work as well.
All right. Thanks a lot, Cash. And sorry, folks, for having some issues with the technology. But please, if you want to put your comments in the chat window, we will go ahead and try to address them that way as well. All right, so let's look at the tools that we have to help you assess. And we're really in the beginning, not the beginning phases. I mean, we have here, you can see the self-assessment tool for public CAAs. And then if you go to the next slide, you'll see a sample of the page that we have. We have a page in that earlier that we just showed you. There's a page for every standard. We have some guidance that's specific to public CAAs, an area where you can delineate whether you met the standard or didn't meet the standard, and just some suggested documentation. Now, some states have taken these tools, which is great. They were built for agencies and states, and have incorporated these questions and this model into their monitoring tool or into their assessment tool. So we're encouraging agencies to also make sure you're going through your agency, figuring out where you're meeting the standards and where you're not. You may want to begin pulling that documentation. I'm beginning to really envision two separate kind of binders. I like to think in hard copy. That we have a hard copy book of all the standards where I've documented where I've met and not met the standards. And then I might have a secondary book where I have sets of advisory board minutes. I might have a copy of my strategic plan. I might have a copy of my county-wide strategic planning process that I'm using to fulfill my strategic planning standards. I might have a needs assessment. Might have copies of focus group summaries, things that I need to use to document to the state that I'm meeting all of the organizational standards. We'll show you here a little in a couple of slides kind of where my head is at least at the moment. So again, we have a glossary of terms that we're happy to add to if there's something here we didn't have specific to public CAAs. We're certainly happy to add to it. So if there are some questions or concerns you might have about terms, let us know what they might be, and we're happy to add to this document. So if we go to just a visual of the tools in development, again, this is kind of, we're working with NASCAS to develop tools for states. But we would like to share them with agencies too so you can kind of get a sense of where, again, the heads are at in terms of trying to assess. Both agencies and states want this to be an easy process. You have enough on your plate as public CAAs that you don't need another level of rigmarole that's going to take you a lot of time. Now, I'm not here to say, documenting your meeting all 50 standards is an easy thing. I understand it's going to be challenging. The partnership, we are going through this as well and assessing our own organization against the 58 private standards. But you can see here, this table, it talks about, it lists the standard, lists the category, and then it said, did the CE or CSBG eligible entity, did they say they met it or they didn't meet that particular standard? And then what documentation did you use or did they use to show that you met the standard? And again, this is where I'm beginning to think that instead of listing out all the different things that you would use to prove it, in essence, or justify it or document it, I would turn to a page number in that secondary binder that would have all of my documentation materials. And then certainly a space for notes. Now this is just one thing we're working with, we're playing with it, trying to see if this works out or not. And again, these are just going to be options for states. Nothing is going to be mandatory, again, because states have the ability to assess agencies however they see fit, because again, it is a block grant. Nobody has any mandates that we can give to states except that they do need to find a way to assess you and report how many agencies met 100% of the standards as part of their annual report. So if we go to the next slide, and historically we've been talking, when I'm out in the field talking about standards, I've been talking about, well, let's talk about the leadership standards or the governance standards, the financial leadership standards. But more and more when I'm talking to agencies, and so they say, well, it's less that than it's really now the rubber hitting the road. We need to think about what has to happen every year. What needs to happen every 2 years, every 3 years, what's kind of ongoing. So we're beginning to take apart our previous document and kind of putting it back together around timing. Because from a practical situation, you need to know what needs to happen every year, every 2 years, etc. So we're going to just quickly walk through these standards, clumped by time period, make sure everyone's on the same page and refresh our memories with kind of what's in the standards, and again, see if there's any comments or questions about any particular standard. 4.4, these are the pieces that have to happen annually. That your advisory board receives an annual update on the success strategies in your CAP plan. We've already just talked about that. That your advisory board has received an update on meeting the goals of the strategic plan. Or again, comparable planning document, because public CAPs are oftentimes part of a broader public process. If you can tease out what you need out of that process, you do not have to do a whole separate strategic planning process. 8.3, the advisory board is notified of the availability of the local government audit. Every year, your local governmental unit has a full-blown audit. The odds of you being able to impact that audit are probably slim to none, oftentimes, given that it's kind of buried within governmental layers. But what we're saying here is that the board needs to be notified that the local governmental audit was done and that it's available, whether it's for public review, whether there's a public hearing. You do not have to provide a copy of that to your board. You just need to make sure that the board is aware that that audit has been done and that it's available. 8.4, the tripartite board is notified of any findings in that audit that's related to CSBG funding. So you're saying, well, the odds on that are even slimmer. Well, that's good. But if there are any findings specific to the CSBG department, and even more specifically to the CSBG funding, the standard says that you do need to let your advisory body be notified of that. Not that they're going to be able to impact it, because that's certainly not how it runs in a public CAP usually, but that they need to be notified that that's the case. 9.3, that the advisory body the department has presented to the tripartite board advisory body for review or action, again, within the past 12 months, and analysis of the agency's outcomes, et cetera. We went through that a little bit earlier. That's the new standard 9.3. 9.4 is a no-brainer. The department submits its annual IS survey data report. You do that already, and that it reflects client demographics and agency-wide outcomes. Again, that's already happening as part of your IS report. I'll pause here. Anything in the chat window or any raised hands under the annual standards, Cashin?
Not so far.
All right. Moving on then. What needs to happen every 2 years? The 5.4, the department documents that each tripartite board or advisory body member has received a copy of the governing documents within the past 2 years. You probably have a set of bylaws for your advisory board. If you don't, you might have some other types of governing documents that talk about maybe how people get appointed, how votes are taken, what makes a quorum, meeting frequency, whatever that looks like. Those are the documents that need to go out to your governing board, your advisory board every 2 years. Standard 5.6, each tripartite board or advisory body member has signed a conflict of interest or comparable local government document within the past 2 years. Now, I know sometimes public CAPs, if you're serving on an advisory board, you have to go through ethics training. You might have to participate in a recorded ethics training or a live ethics training. We would consider that to be meeting this particular standard. If you don't have something like that, many times local governments are much more attuned to conflicts of interest just by virtue of the governmental structure. If you still don't have a document that would be aligned with that, we could certainly try to hook you up with a group that might be able to provide a sample of that, and certainly CAP Law would have some resources in that area as well. 5.8, the advisory body has been provided with training on their duties and responsibilities within the past 2 years. Again, very similar to the private CAP, that those advisory body members, it's good to be refreshed with training. What are your roles? What are your responsibilities? What don't you have power over, but yet what do you have some control over in terms of influencing how the department is running and how CSBG resources are spent? So those are the standards that happen every 2 years. Anything come in, Cashin?
Does not. Actually, we do have one. Since low-income representatives are elected by low-income neighborhoods, do they need the conflict of interest?
Yes, they do. Good question. Yeah, all parts of the tripartite board need to sign that conflict of interest form. It's always good to remind board members when they come to that table, they're kind of taking off the hat of the group they're representing in some ways and other ways not. certainly, especially the low-income folks, are there to represent those communities. But sometimes we talk a lot about this on the nonprofit side of the CAP house, that sometimes a board member has to vote to close a program or discontinue a program that might negatively impact their local community because they're there being a board member, not so much just being a representative of a particular community. Now, on a public CAP board, that might look and feel a bit different than that, but the same sort of acknowledgement that they might have an inherent conflict because they're there to serve the entire community when they sit in that advisory capacity, that it's a good reminder that they can't just represent their own local community. Good question.
Great, thanks. We have another one. We're actually going to scoot back a couple of slides into the annually category, looking at 9.4, which is that the department submits its annual CSBG IS data report. And the question is there any further clarification available regarding how 9.4, reporting agency-wide characteristics and outcomes, is very broad for a multi-service public human service agency?
That's a great question. It always seems to be the million-dollar question. Right now there's no additional guidance, nor has anything changed from the previous requirements. So depending on how you worked that with your state in terms of how you're reporting on your IS report currently around agency-wide or organization-wide outcomes, that should not be changing. I know in some places the CSBG department only has CSBG. Other times it has CSBG and LIHEAP. Might have CSBG and housing. Might have all three of those components. Could have a variety of different pieces. So the question can be, do we report on everything? Everybody who's coming through our department. And again, the variances are so great that I can't really speak to it on this kind of session. If you want to shoot me an email, we can try to get some additional clarification on your unique situation. But I would kind of refer you back to your state and to what you're currently doing, because nothing in the standard would change your current definition of your agency-wide outcomes. I say that knowing that I've read the IS reports, and when we get the final report from NASCAS, what do we really mean by agency-wide? We need it to be apples to apples, and I'm not sure we're quite to apples yet. I know that's probably not a satisfying answer, but that's all I got.
That will do for now, and of course, keep those questions coming as we jump back to the every 3 years standard.
Great. All right, let's go to every 3 years, standard 1.2. For the public CAP, the department analyzes information collected directly from low-income folks as part of its community assessment. Odds are you're probably already doing that. So when you're doing your community assessment, you're probably doing focus groups, maybe you're doing some surveys, maybe you're doing some key informant interviews of low-income folks, but you're collecting and analyzing that information. 2.2, the department utilizes information collected directly from key sectors of the community in assessing needs and resources during the community assessment process. Now, these sectors would include, at minimum, community-based organizations, faith-based entities, private sector, public sector, and educational institutions. Now, these standards all really around every 3 years focus around the community assessment because, again, the community assessment is now done, at least mandated, at least every 3 years. Now, to meet standard 2.2, you do need to document in some way, shape, or form, notes, minutes, appendices to your community assessment might be some ways to do that, that you've talked to community-based organizations in your community. It might be Catholic Charities, it could be a multi-service-based nonprofit, it could be the food bank, it could be a variety of groups that you're talking to. Talking to other to faith-based organizations, churches, synagogues, mosques, others that might be providing from a faith-based perspective. You're talking to the private sector about needs and resources in your community, Chamber of Commerce, Business Improvement District. There are a variety of ways you could touch base with the private sector. Certainly your public sector colleagues, I'm sure there are other departments at your local governmental units that address families living in poverty, talking with other colleagues that you don't normally talk to perhaps to look at needs and resources in your community, and then educational institutions. And again, to meet the standards you do as part of your organizational assessment, or community assessment, touch base with somebody, at least one in each of these categories. So standard 3.1, the department conducted or was engaged in a community assessment and issued a report within the past 3 years. Again, because public entities sometimes do their community assessment within a broader-based assessment, whether it could be, again, part of a housing department, you might be doing a broad-based assessment, you might be part of a health department that could be doing a broad-based assessment. There are sometimes ways that public CAAs do this without doing their own individual assessments, so that's why there's a bit of a hedge in there. But if you're not part of a broader piece, you do, as you have currently, need to do a community assessment. 3.2, as part of the assessment, again, the department collects and includes data specific to poverty and its prevalence related to gender, age, race, and ethnicity. You're doing that already. If you're doing your needs assessment, odds are you're looking at statistical information on poverty, and you're breaking it down hopefully by gender, race and ethnicity, age, and gender, among other delineations as well. But at minimum, those are what has to happen. And again, 3.3, the department collects and analyzes both qualitative and quantitative information, which means you're taking quantities of things, numbers, survey data, Census Bureau data, free and reduced lunch, teen pregnancy rates, whatever you're looking at. That quantitative data will be part of your assessment, and then qualitative. Those of you who are aroma trainers know that we talk a lot about talking to people, and perhaps focus groups or key informant interviews are great ways to get a qualitative data collection. 3.4, we talked about this earlier, the community assessment needs to include key findings now on the causes and conditions of poverty as well as the needs of the community assessed. And then 3.5, the tripartite body needs to formally accept the community assessment. This does not need to be a huge endeavor. Hopefully you give a copy of the assessment to all of your advisory body members at a meeting, maybe in advance. At the advisory body meeting, people would say, yes, we've reviewed and we accept this document, easily documented by a board vote and included in the minutes of the advisory body meeting. So those are the every 3-year slides. Comments or questions that have come in, Cashin?
Sure. If we scoot back to standard 2.2, if all of those sectors are already on your board, does board input make you meet the standard?
Interesting question. I would probably say if you had on your advisory body, right, if you have a CBO, you have some faith-based folks, some private sector, you could possibly, I think you can meet the letter of the standard. If you use those folks, you talk to them separate from their board or advisory body conversation because they're sitting there in probably their official capacity in some way, shape, or form. To meet the letter of the standard, yes, but to meet the spirit of the standard, you may want to talk to more folks or different folks than you typically would engage with. But I think probably if you were going to meet the letter of the standard, that probably would count. But again, that's up to your state to assess whether or not you meet or not meet. That would just be my, and again, I don't speak for OCS or the state or anybody, but my impression that that probably would count.
Great.
Other questions?
I think that gets it for now, so we can move on to the 5-year ones.
All right, so we get to take that 4th year off, except for the annual and ongoing ones, but every 5 years, we have a number of things that need to happen. 4.1, and again, a lot of these fit within that strategic planning framework. But 4.1 is specific to your mission statement, that your advisory body has reviewed the department's mission statement within the past 5 years and assured that the mission addresses poverty and that the CSBG programs and services are in alignment with that mission. Now, I've run into many, many public CAAs who clearly are incredibly passionate about their mission and vision as a department or as an organization. So I think I've seen a lot of really rich and fruitful mission statements out there, and I've rarely seen a mission statement that does not address poverty in community action. That is our purpose as a network. So I don't find that to be too much of a challenge, especially on the public CAAP side. But if you don't have a mission statement, this might be something your advisory body will want to take on in the next few months and either adopt a mission statement and, again, make sure it addresses poverty in some way, shape, or form. You don't have to use the word poverty. Use family self-sufficiency, economic mobility, economic security, whatever is going to be meaningful to you. But again, if you have not done that, now might be a good time to adopt a mission statement. Now, oftentimes, mission statement review will happen within a strategic planning framework, which is why these are oftentimes tied together. So if you look at 6.1, the department has a strategic plan or comparable planning document in place that has been reviewed and accepted by the board and advisory body within the past 5 years. Now, if the department does not have a plan because you're part of a larger governmental planning process, then the board needs to develop a plan. Now, it doesn't have to be overly complex. It doesn't need to take months upon months to do, especially in a public cap environment. If you're a relatively small public cap, we could talk, maybe look at doing a special training on how you might do that with advisory boards if that's something that folks are interested in. But we'd certainly love to see examples of good strategic plans that public caps might have, as well, so we can share them with other caps in the network. Now, 6.2, the approved strategic plan or comparable planning document addresses the reduction of poverty, revitalization of low-income communities, and or empowerment of people with low incomes to become self-sufficient. That language comes right out of the CSBG Act. And again, you don't have to have those terms in your strategic plan, but again, thematically, it needs to address those areas because again, that's the purpose for which our entities are created. 6.3, the approved strategic plan or, again, comparable planning document contains a level of family, agency, and or community goals. Now that and or applies to family and or agency and or community. And odds are your goals are going to be falling into one of those three categories. And again, 6.4, that customer satisfaction data and customer input that you've collected as part of your community assessment is included in this planning process or comparable planning process. That it's used as not that you're recollecting that information, but that you've already collected it. Let's find a way to use it in our environmental scan as we do our strategic plan. Questions or comments on every 5 years?
I don't see that any have come in, but of the people that did send questions before, they did seem to kind of center around the strategic planning, either a particular standard or the entire category. So I would encourage, if you guys have already done some work in this area, you have a best practice you'd like to share with your colleagues, I think this would be a fantastic opportunity to do that as well.
Great. All right, well, keeping an eye on the clock here, let's move into the ongoing standards. These are things that just don't happen annually or every 2 years. These are things that kind of have to be in place on a regular basis. So when you think about these standards, think about how you would document that you meet them. So you demonstrate low-income individuals' participation in your activities. Again, many of you may have folks living who have low income serving on your advisory body already. That would certainly look at counting. You may be involving them in training, community forums, a lot of different things, ways that you can involve low-income folks in your work. 1.3, the department has a systematic approach for collecting and analyzing customer satisfaction data as a tripartite board, which could be met through broader local government processes. You might be part of a broader department, and if that department's already doing customer satisfaction surveys, you do not have to replicate that and start from scratch. You can use your broader department's satisfaction studies if that's already happening. 2.1, the department has documented or demonstrated partnerships across the community for specifically identified purposes, and these need to include other anti-poverty organizations in the area. Odds are you're probably cooperating or partnering with a variety of entities, both public and private. Some of those probably have a letter of agreement or some sort of MOU or letter of cooperation in place. Those kind of elements don't have to be in place for all of your partnerships. We just need to demonstrate that we have some level of formal partnership within the CSBG department. Standard 2.3, the department communicates its activities and its results to the community. You're probably already doing that oftentimes now through the web. Many of our CSBG departments have very vibrant websites in terms of talking about what they're doing. They don't always talk about CSBG, but they're certainly talking about the great work that's going on, both either done by the local government or that they're subbing out to other nonprofit entities. 2.4, the department documents the number of volunteers and hours mobilized. You're already doing that. You're having to report it. So this is just reinforcing that. And we've talked about 4.2. Oh, no, I guess we haven't talked about 4.2. The department's CAP plan, again, is outcome-based, anti-poverty focused, and ties to that community assessment. And that's replicating the Roma cycle that, again, the work we're doing ties in some way, shape, or form to the community assessment. Now, we know there are political challenges, certainly when it comes to public CAPs, and if you've been providing services in X area, you're going to possibly really keep providing services in X area because that's how it's budgeted. But hopefully you're able to tie back those kind of services that you're providing in some way, shape, or form back to your community assessment. If you're not, then that's a different kind of conversation that has to probably take place, and again, that'll be up to your state to determine kind of what that means in terms of meeting or not meeting the standard. But we also recognize there are political challenges sometimes in public CAPs that don't exist in the nonprofit side, that control is out of your capacity to impact. Sometimes you do have the ability to impact it, but that's not always the case. So let's go to 4.3. The department's CAP plan and strategic plan, again, document the continuous use of the full Roma cycle. Again, that you're assessing, that you're planning, implementing, documenting your achievement of results, and evaluating your performance. Now, it does say comparable system. That says that only because that's what the Act says, that a state can elect to choose a different system other than Roma. I've yet to see really a state choosing a different system other than Roma, although if you look at the state plan, it clearly asks states now to say, what system are you using if you're not using Roma? So we'll get that answer whether we like it or not the next time around. But this basically means you need to show that you're assessing, you're planning, you're implementing, you're documenting, and you're evaluating. In addition, you need to document that you've used the services of a Roma certified trainer at some point during the process. This does not mean you have to have a certified Roma trainer on staff, although that can be incredibly helpful and can assist in implementing CSBG programs and services. But that at some point during your year or 2-year cycle, you're talking to someone who is a certified Roma trainer just to touch base. Is what we're doing making sense when we're doing our assessment? Or if you're doing your planning process, how would you structure this? Or let's touch base on that. So it's going to be important to connect with perhaps a Roma trainer either in your state or perhaps in a neighboring state. You don't have to be locked in just to Roma trainers in your state. 5.1, that text is really small, isn't it? All right, so the tripartite board structure is structured in compliance with the CSBG Act, which makes sense because you're already doing that, that you have certain, the tripartite structure, 1/3 democratically selected, et cetera. So again, you're already doing the tripartite structure. There are some nuances here for public CAPs that are noted here as well. 5.2, the department's tripartite body again has written procedures that document a democratic selection process for low-income board members to assure that they are representative of the low-income community, or another mechanism specified by the state to assure decision-making and participation by low-income folks. Now that's again the caveat for public CAPs. So again, please note under IM 82 for public entities, the law also requires that a minimum of 1/3 of the tripartite board membership be comprised of low-income folks who reside in the areas served. So it gets to that earlier question, certainly that your low-income representation needs to live in that area that you're serving. 5.5, the department's tripartite board meets in accordance with the bylaws or the governing documents of the organization, the department. The department has a process for providing structured orientation for new advisory body members within 6 months. And the advisory board receives programmatic reports at every advisory board meeting. Odds are you're already doing that. But again, it doesn't have to be in writing. It could be a verbal report, it could be a summary report, it could be just on part of the work you're doing, but some level of programmatic updates. 7.3, that you have job descriptions for all positions. Now on the nonprofit side of the house, we talk about updates needing to happen every 5 years. Again, updates may be outside your purview as a public CAP, so it's only that you just have job descriptions for all positions. 7.7, the department provides a copy of the, again, whistleblower policy to members of the tripartite board at the time of orientation. So making sure that you're providing that as part of your orientation packet of materials. 7.9, the department conducts or makes available staff training, including ROMA, on an ongoing basis. 8.7, the board receives financial reports at every advisory board meeting as allowed by local government procedure. Now, on the nonprofit side, certainly they have to give much more comprehensive fiscal reports. But here on the public cap side, you have less flexibility. Those may or may not be allowable from your local governmental unit that's overseeing the financial component of what you're doing, and may just have to be relegated to the programmatic side. But if there is the capacity, you do need to be able to provide some level of financial reporting, like revenues versus expenditures, to your advisory body members. 9.1, the department has a system or systems in place to track client demographics and services. Again, this does not say you need to have a singular system. You can have multiple systems. It also does not say you need an unduplicated count, although we do need that for the IS report. There's nothing in the standards about an unduplicated count. And finally, 9.2, now the department has a system or systems, again, in place to track outcomes along a similar track. Now, there are several places here in public caps where you need to follow local regulations that make you a little bit different. And then the nonprofit side of the house, again, we've talked a little bit about that. You can see here standard 4.5 that you fulfill your policies and procedures around filling interim appointments and processes. On the nonprofit side, boards need to, hire the executive director and things like that and have a succession plan. That's not always possible on the public side. The department needs to comply with local governmental risk assessment policies and procedures. 4.6. Standard 7.2, the department follows local governmental policies in making available the employee handbook or personnel policies. Again, some of those decisions may be outside of the local department's jurisdiction. 7.4, the department follows local governmental procedures for performance appraisal of the department head. Again, on the nonprofit side, the board has to evaluate the ED. On the public side, that's not always the case. That means it's done through a whole separate process. So as long as you're following governmental procedure, you're good to go. 7.5, again, the compensation of the department head is made available according to local governmental procedures. Sometimes we find local governments are much more transparent than private entities are. But again, if you're under the Sunshine Act, or a lot of times you'll have public salaries are available on the web, the CSPG department head also needs to be available for public review. 7.6, the department follows local governmental policies for written evaluation of their employees by their supervisors. Again, oftentimes union contracts, civil service, other things will impact frequency and requirements around evaluation. The standards certainly can impact that. We're just saying that you need to follow your existing procedures. 7.8, that you follow your governmental procedures for new employee orientation. 8.1, that your audit is done through your regular governmental process in compliance with the super circular or other state audit threshold requirements. 8.2, the department follows local government procedures addressing any audit findings related to CSPG. Odds are that it's probably out of your hands as CSPG department folks. 8.9, the advisory body has input into the local governmental procedure, into the budget process as allowed by local government. Excuse me, I totally just read that all totally wrong. My apologies. The tripartite board has input as allowed by local governmental procedure into the CSPG budget process. Now, if you look at the spirit of the CSPG Act, the advisory board should have some level of impact on that budget for CSPG. That may or may not be happening. We hope it is happening. The local board knows what's going on in the community and should have some level of sway in terms of how the department is addressing poverty in their communities, but we also know that that's not necessarily how it always happens. So you need to follow local governmental procedure on that. And 8.13, the department follows local governmental policies around documentation or document retention and destruction. Again, local departments may not have much to say about that. That's oftentimes already prescribed by governmental procedure. And again, there are several standards here that don't really apply because you're a public entity. We've talked about some of those already, personnel policies, bylaws, things like that. All right, I'm just going to bounce down here then a couple of slides. I know we're at the top of the hour. We do like to remind folks that we do have a handout for advisory boards and boards of directors up on our website. It is primarily currently the draft we have up there is written from a nonprofit CAPS perspective, but we are looking to develop a public advisory body staff, or excuse me, an advisory board two-pager that talks to advisory board members about their roles and responsibilities around standards. You'll see here we have a series of videos done for the nonprofit boards. We also hope to do something for the governmental advisory body members as well. We don't want to freak those members out. We also want to add to your burden, but we do know that those advisory body members do need to be paying some level of attention to org standards. So we want to make sure that they have the level of information that they need to have to be aware of that. So a couple other things here, and then we'll pause again for questions. We have a variety of tools and resources up on our website that help take advantage of. Have our website. Getting a lot of feedback, Cashin. There's a way to do that. Thank you. CommunityActionPartnership.com. If you click in the upper right-hand corner, you'll get National Training Center tools and resources. And we have the arrow over there on the left-hand side, update on CSPG org standards Aroma Next Generation. That's where a copy of today's webinar will be posted, along with other tools and resources as they are developed. You have the TNTA Resource Center as well, with a ton of great resources. CAP Law has some really great resources for public CAPs. They have a whole series of videos dedicated to what is a public CAP, how is it operated, the roles and responsibilities of a public CAP. I encourage you, if you haven't taken a look at their website lately, to take a tour about caplaw.org. And then certainly our convention is upcoming in August. We will be having a session for public CAPs on standards, for public CAP only kind of situation. If you are interested in attending that, shoot us an email. It probably will be by invitation only, just to make sure that it is for public CAPs and we can have some in-depth conversation in person. I do know that the end of August is awfully late in the game, so we hope that you do not wait until then if you have questions, so please reach out to us early. And again, here's our email addresses. Jarl Crocker is on the phone as well, I believe. He's our Director of Training and TA. And he's also out of the office today, so it's Cash and Natalie kind of holding down the fort. But you can certainly shoot us an email. That's probably the best way to reach us, and we can certainly set up a time to talk with you if there are questions that are better handled in a conversation capacity. So, Cash, I'm going to pause again. Are there comments or questions or any raised hands?
There are a couple of questions that have come in, going back into kind of that calendar piece a little bit. Talk about the strategic planning. Can the community needs assessment and the strategic plan be the same document?
Good question. Have had that question from other groups as well. No, those really are going to be two separate documents. Even if you do a lot of that work simultaneously perhaps with one another, I would still title each document separately. Now, an assessment really should be an assessment of the community's needs, what the poverty looks like, where the pockets of poverty perhaps were some pockets of deep poverty, what are the system issues that are impacting poverty, what do people think about the needs in the community. Whereas a strategic plan is kind of how are we going to address, we've identified these needs, now how is our department really going to structure itself or design resources or partnerships to meet those challenging needs in our community. Now, I do talk about a community needs assessment. Ideally, it is a community assessment that also addresses, hey, what resources do we have in our community? So that when you're addressing your plan, you can tie your needs to say, well, we have these resources in the community. How can we make sure to connect our clients with those resources to help them better meet the needs that they're identifying? Easier said than done. Don't mean to be Pollyanna about any of that, but technically, I mean, they are really two separate pieces. One is about assessing what's going on. The other is really the resource that you're developing to say this is how we're responding to those needs in the community. They do tie together very closely.
Great, thanks. Next up here, we have what defines outcome-based when it comes to the CAP plan?
Good question. This is nice in some ways because we see that this challenge for that particular standard is really more on the state than the agencies, because we do read the CAP plan as kind of the contract you have with the state. States should have been moving over the last few years from an output perspective to an outcome perspective. So we're hoping that state contracts and state work plans and such are more outcome-based. So instead of providing X number of emergency rental assistance payments, how many are you able to talk about more outcome specific? How many folks are able to maintain their home for 30, 60, 90 days without eviction, things like that. So it's shifting from counting what you're doing in terms of outputs to counting what's happened in the lives of families as a result of those services. But I think technically a lot of that's going to be dependent on your state contract. So hopefully your state has been moving on some of that.
Great. Next up, can we define ongoing under 7.9? And just a reminder, 7.9 is the department conducts or makes available staff development and training, including Roma, on an ongoing basis.
Yeah, it's interesting. When we were developing the standards, you may recall we left a lot of the definitions kind of vague in nature, so agencies could determine for themselves what it's going to mean to meet the standards, but people are wanting a bit more frames around things. We don't really define that ongoing means that you have to continually provide it, but if you annually had an all-staff day, that certainly I think would address something like that. If you're able to if staff are able to attend ongoing or training opportunities in your local governmental unit that's being provided by a training department or professional development. If you don't have those formalized structures, there's a lot of tools and resources up on the web, whether it's our webinars, CAP Law webinars, and others, that you could possibly make sure that you're providing to your staff as options for staff training that they're participating in, certainly conferences and events. It does say including Roma. I think most training that we do in some way, shape, or form fits within the Roma cycle, maybe around how we assess, how we plan, how we implement. So Roma isn't necessarily meaning you're sitting down and doing the 8-module Roma training. It's meaning that you're really talking about Roma concepts in some way, shape, or form with your staff. So I wish I had a better answer for you that was a bit more tangible, but that's kind of where we've ended up on that.
Great. Next up, if we could get some example processes for 5.1. I'm going to assume that this is kind of both 5.1 and 5.2, which is that the department advisory body is structured in compliance with the CSBG Act by either selecting the board members along the tripartite structure or other mechanisms. So are there any example processes to meet that democratic selection piece?
I would probably refer you to CAP Law. My understanding is they do have several examples of what it means to go through the democratic selection process. It may mean having people sign petitions. It can mean neighborhood associations or neighborhood centers have an election within their own group to select someone to be considered by the advisory, to be considered to be appointed to the advisory body. But I would refer you to CAP Law for specific examples that are in compliance with the Act.
Great. And just as a kind of a general reminder, we've had a couple of different notes or questions along this line. Yes, we did record today, and we will put the PowerPoint along with that recording up on the partnership's website tomorrow on that updates to organizational standards and Roma Next Generation quick link that we showed earlier. So do check that out tomorrow to be able to review this. And last but not least, who do we contact about having a public CAP session at the national conference?
You can either, I would email Cashin. If you have that email slide up, Cashin, I would go ahead and shoot you, anybody on that list you can shoot an email to, and we will certainly start a list. And everyone who's registered for this webinar today, we will certainly send an invitation to as well. Now, we'll probably not have conference call capacity, although we can check into that. The idea is to kind of have a comprehensive conversation in person, if at all possible, for people who are there. But we know not everybody has the flexibility to travel out to San Francisco for the event.
Great, and yes, my email address is up on the screen, so do let me know and we will make this happen. One last kind of late-breaking question that's come in. Under the documentation use section, which is back on our kind of assessment tool, are all listed items required to meet the standard?
Good question, no. I think if you had, sometimes we'll list 3 or 4 options, but if you show in your board minutes that the board looked at the progress you're making in your strategic plan and that's documented in your advisory body minutes, I think you've met the standard. So you don't have to use everything. You can just pick and choose about what you think is going to be meaningful to you and your state monitor to show that you've met the standard.
Great. That's all I have in the chat window. I do have a hand up for Robin Rink. I hope I am pronouncing that correctly, but you are unmuted on our side if you would like to verbally ask a question or comment.
Maybe.
All right then. And are we assessing where we are in relation to standards? If we need help interpreting a standard, who do we ask?
We are happy to respond to specific questions about interpretation wherever we think we can. It is going to be up to states to work with their agencies in their states to agree what meets the standard. We're seeing that some states are sitting down with their CAP agencies, both public and private, to walk through each standard and say, okay, in our state, we agree this is what it means to meet a standard. And in some situations, for instance, if you're only 2 years into your, well, you don't have the audit requirement, but if you've already done a strategic plan and maybe you didn't include certain things, do you have to redo that strategic plan? I mean, those are the kind of questions we're looking at for some agencies right now. But shoot Jarl or Kasia, Natalie, or myself an email, and we will see what we can do to get you our perspective. But it is kind of up to the state to make the determination, along with you, about what it means in your state to meet that standard.
All right, then. That is all we have, and we are coming up on 3:15 Eastern, so we are coming up on the time that we asked you to hold aside for this, but this is not the end of the conversation by any means. So do reach out to us, and hopefully we'll see you in San Francisco. Any parting words, Denise?
No, we really appreciate you being on today, and we will look to schedule another call this summer as well as we move toward implementation deadlines. You guys have really been great over the course of the last 2 years on helping us to develop the standards. I know we get questions in the field from public and private entities, and keep those questions coming because they certainly help us frame up the questions we bring to OCS. So keep those calls and letters coming, as they used to say.
All right. Great, everyone, and have a fantastic afternoon.